All you need is your ID, proof of address, 2 payslips, and a job letter. No security required. Loans for rent, utility bills, medical expenses, and car repairs until payday. Rapid Loans Financial Services. WhatsApp 876-403-8048.
Thank you so much for joining us on this special COVID-19 broadcast. I'm Dr. Rosen Green. The coronavirus has spread across the globe, almost all countries on the planet. One of such countries is the United States of America, that have 1.2 million confirmed cases and over 70,000 deaths. Today, joining me from Brooklyn, New York, via Skype, is a fellow journalist and award-winning documentarian Chante Graham. Thank you so much for joining us.
Hi, Rose. Thanks for having me.
Thank you, Chante, because this is a very serious issue. Coronavirus started in Wuhan, China, spread across the globe, and currently the US is the hardest hit country. Talk to us about 3 months ago, when it confirmed its first case, what was happening there?
Well, about 3 months ago, I guess that's when they first started to, when the cases started to happen in New York City. But I think it just took a whirlwind turn, and the hospitals became overwhelmed. I heard stories about Kings County and how they had, bodies laying around, people, doctors basically determining who lives and who dies. So it
Right.
kind of overtook New York really, really quickly. And I attribute that to being that it's so many people that live here. And, as far as New York is concerned, we're all concentrated in such small areas. So you'll have a area, you could say like East New York or Brownsville, and you have, upwards of maybe 50, 60,000 people in a small area. So I don't think New York was quite ready for what was to happen.
Right. Let's look at in terms of minority groups, and that's the
Hmm.
focus of our interview this afternoon. Over 300,000 Jamaicans are living in New York, a majority living in Brooklyn, where that's where most of the cases are recorded in New York, correct?
Correct.
So talk to
Okay,
us
so
about how persons are handling it there, especially minority groups.
well, one of this is my reasoning. I mean, not just my reasoning, but it's also confirmed. If you check the CDC website, there one of the disparities I would say is that because Black people, African Americans, I'm just going to lump everybody together. We're
Right.
the ones who are on the front lines. We're delivering the food. We're the orderlies. We're cleaning up. We're more susceptible to getting the virus because of the jobs that we do. You know,
Right.
we're cleaning up the office buildings. We're handling the bodies. We're doing everything that's on the front line to make us more susceptible to getting the virus. And that's one of the things that they're not really talking about too much in the media. They're saying that that Black people we have more underlying health conditions. We live in concentrated areas, but the one thing that I don't find them talking about too much is that we're the ones who are actually, doing these jobs. We're working for Amazon, we're delivering, we're out there, and a lot of times, which I know personally, people who can't take off, or their jobs won't let them take off, or they won't get paid. So it comes down to, am I going to risk my life and go to work to earn a living, or am I going to stay home?
Right.
And I think that's one of the main reasons that we're the ones who are out there actually, in the streets.
Right. Let's look at the essential workers, nurses,
Hmm.
doctors. who are working in the hospital. I had one nurse who wished to remain anonymous, says that we don't have enough equipment, or we don't have enough safety equipment, that is, to safeguard us from the virus. We're afraid to go home. Speak to me or to my viewers regarding what you're hearing on the ground.
Well, one thing now, Governor Cuomo, put into effect that everybody should wear masks in public. So when you're going to the supermarkets, you have to have a mask. Restaurants aren't open, only for takeout. But the thing is that, where are you going to get a mask? That's another thing. We don't have any masks. So I
Wow.
can't go to my local store and buy a mask. Um, I have, and it wasn't until I think it was an article that came out in the New York Times that said it was mandatory, it was necessary to stop the spread of the virus by wearing a mask. All before that, there was no, people were saying, oh, you don't need a mask and you don't need it, it's not necessary. But I knew from the start that you needed one, but you can't get one. You can't go to your local store. They're not in Target. They're not in the supermarket. So if you can't find a mask, what are you going to do? If you're not, now Amazon is only selling masks to special essential workers like nurses, doctors. So the average person cannot get a mask. So how could you protect yourself if you can't even find a mask? So that's another issue that that we're facing in New York.
Wow. For persons who have to go out and work,
Hmm.
do they seek their employers to provide them with masks so that they can travel on the train? Because currently, as we see, normally over 1 million person travel a day
Hmm.
on the New York Transit, but currently it's drastically cut to less than 100,000 persons per day. So is it that employers are advising their employees to stay home, or persons are just making the choice to stay home?
Well, I think it depends on where you work. So if you work in an office building, or say a bank or a finance company, insurance company, and your company has the capabilities to work from home, you will be one of the fortunate people who are able to work from home. Transit workers, they can't work from home, you know, and there have been a lot of people in the transit system that have died. Say you clean an office building, you can't work from home. So those are jobs that people are now deeming essential. You can't work from home. So I think a lot of people who are not riding the trains is simply because their offices are now remote. It's not because people just aren't going to work, and they also cut service in New York. So actually now we have a problem with homeless people riding the trains at night. So they just put into order that from 1 a.m. to 5 a.m. that they shut the trains down to clean them. So now
Oh,
we have to have an issue of where are these homeless people supposed to go, because
right.
they don't have masks, they don't have hand sanitizer. So now you have a double threat of not only them catching the virus, but passing it on to people who have to take the trains every day. So that
Right.
was like a really big issue, and the mayor and the governor collectively said they're going to shut down the train system. And as you know, the New York City transit system is essential for everybody that lives in New York. Like
Right.
you don't need a car, but you have to be able to get on public transportation. And as you know, the ridership, the trains are definitely a breeding ground for the coronavirus, because there are so many people that ride the trains, and there's no way to kind of escape that. And if you don't have a mask on the trains, you're pretty much probably going to catch it.
Right. I see different organizations assisting to help the homeless.
Hmm.
Is there anything that the government is doing to help to house the homeless, to ensure that they have hand sanitizers? What are those things that they're doing?
Well, so I've heard that people are going around giving them out to homeless people in the streets. I've come across plenty of homeless individuals in New York, in Brooklyn, and none of them had masks on. And basically, since the city is kind of, there are less people on the streets, so now with the homeless, they don't want to go to the shelters. So they're pretty much just living on the street. And now with the weather is being, warmer, they're they're out there. But me personally, I have not seen too many homeless people with masks on.
Right.
And I mean, we can't even get hand sanitizer. That's another thing. That's not in the stores either. So if you
That's
can't
right.
get hand sanitizer and you can't have a mask, how could you protect yourself?
Wow. Also, they're rolling back some restrictions on on a number of states. As of Monday, a lot of businesses were ordered to reopen. Some even have cases where corona cases have been still rising, yet a lot of business, for instance, barbershops, are, are becoming, well, going back to business as normal. Talk to us in terms of the fears that you hear from persons on the ground as it relates to reopening of businesses.
Well, I think that to his credit, I will give Governor Cuomo a lot of credit because he is being strategic in how he opens up businesses. I know in other states they're opening, which you have to look at the data and see that the cases are rising. So you have to make that determination as a business owner. Do I open my store knowing that it's not safe and I see the numbers rising or that second wave that they talk about? Or do I
Right.
stay closed? And if I stay closed, how do I feed my family? So it's the business owners are kind of scared, and the people are scared, and I think it's a common sense judgment call, in my opinion. You have to, despite whatever the news says, the media says, you have to use your common sense when you are traveling or when you decide if you're going to go back to work, or how do you decide to move. That has to be common sense, and you have to look at what the doctors are saying, and the cases are rising, and in those same states where they're doing reopenings, like throughout the South, they have cases that are rising. So
Right.
once again, use your common sense to
Right.
see, should I be going out or should I open my business?
Wow. Currently, over 1,700 cases of persons dying each day. And the reports are that by July the 1st, over 3,000 persons. How is the government, how is the president, how is, in terms of the mayors, handling those projections?
Well, I know in New York, the governor and the president aren't have mixed. If you listen to the president, it's one thing that everything's okay and we're doing fine, but
Right.
I saw something on CNN when he said, "Oh, we have 60,000 deaths. We're doing fine." So, like, how is that doing fine? How do you explain to someone that their loved one died, and it's like, okay, this is okay. But I think that Governor Cuomo is doing a great job, and he's trying to get, but he needs the funding. So that's where he has a problem as far as getting funding from the federal government to have the test, because
Right.
that's the most important thing. If you can't test people, you don't know who has it.
Right.
And or we all know that the asymptomatic people spread the virus. So I think testing is a big thing in New York. As far as I know, I do know some people that work in hospitals, and they have limited masks and gowns and things of that nature. But I know the governor was, speaking about getting funding from the president. So
Right.
it's a lot of narratives happening with the coronavirus, and you're not sure what to believe or what's really going on. And people who are watching from other countries, they don't really know how. Who do you know to believe? The president says one thing, the governor says something else, the mayor says something else. So, like I said, once again, you just have to try to use your common sense, and if you want to stay alive and keep your family safe as well.
Right. Talk to us about school. I know a lot
Mhm.
of students here in Jamaica, we have online classes, so we subsidize sitting in a classroom to doing courses online to ensure that students are up to date with their lessons. Talk to us about what's happening there in New York and other states.
Okay, well, New York City has also implemented the school online. I have three nephews, and they go to school online. So I think, and the schools are going to be closed throughout the rest of the year. I'm not sure about other states. I know that I heard that Detroit, they didn't have a plan in place for their children to be online. So I think it depends on the state. But throughout, throughout the U.S., the schools are closed the rest of this year until probably September.
I saw pictures, videos, persons sending videos of Manhattan, the
Hmm.
mecca of New York, where every tourist wants to go and visit
Yes.
and take their vacation. What's the atmosphere? What's the temperature there?
Well, right prior to when we first had a shelter in place order, I had went, you know, being a journalist, I went to venture out to take some photos, and it was just surreal. There's nobody on the street. It's like you can walk through Times Square, you can
Wow.
walk through 42nd Street, Broadway. Everything's dark. Everything is pretty much it's like a ghost town. No traffic, no noise. So it's pretty surreal being in New York, and not seeing people. Because as you all know, New York never sleeps. There's always somebody
Right.
on the street. I don't care what time it is, you'll find somebody,
That's
on the
right.
streets in New York. Yeah. So, but
Wow.
not seeing that it's kind of eerie, to say the
It, it,
least.
it is. It is. For example, persons were moving from Manhattan to Brooklyn. It
Hmm.
was said a year ago that Brooklyn is the new Manhattan,
Oh
where
yeah.
persons are finding homes. It's
Hmm.
beautiful. Commerce. The economy is growing large in Brooklyn. But what is happening now? Because based on information reaching our newsroom, is that a lot of businesses are closed.
Yeah.
Talk to me in terms of when you visit the streets and when you visit different businesses, what's happening there?
Well, pretty much all the restaurants are closed. So if you want food, is basically you have to call to get it delivered, or either you can do takeout. So the movie theaters are closed, the gyms are closed, and New Yorkers love the gym. The gym is closed, the restaurants are closed. So everything that's a major business, the hair stores, the nail salons, the hairdressers, the barbershops, everything that people do in their normal daily life,
Right.
life for us is not the same.
Wow. Because I know persons, they love to visit the gym, as you say. But
Yeah,
that's an area where it's a breathing site for
definitely, definitely.
coronavirus for persons who want to visit the gym.
Yeah.
But for you personally, as a journalist, how has it affected your life and your livelihood?
Well, luckily, I've been able to, my day job. I'm able to work from home, so I'm still able to, support, make a living. I had my aunt passed away from coronavirus about 2 weeks now.
Wow,
So
sorry to
that
hear that.
was a personal experience for me. She was in a nursing home, and there's still a lot of questions surrounding how she died and how she died so quickly. One Another thing to mention in New York is a problem with the funeral homes. The funeral homes are totally backed up. The crematoriums, people are waiting for weeks to have their
Wow.
their their loved ones buried. There was recently something in the news. I don't know if you heard it, but a funeral home had bodies in U-Haul trucks,
Right.
not refrigerated trucks, but U-Haul trucks in
Correct.
Brooklyn. And so that's another story that is not really being talked about. There's People don't have anybody, to bury their loved ones. And just the fact that if you have coronavirus or your family
Right.
member has it, you can't see your family member. So
Wow.
once they're in the hospital, like my
They
cousin, she
die
didn't see her,
alone.
her mother, since March 9th. And That's like the most inhumane part of this whole pandemic.
Right. Wow. I heard many stories regarding that for persons who have elderly family members
Hmm.
in the homes. Talk to us about, because based on information, the coronavirus outbreak started in a home, an elderly home. Talk to us about what happened there and how did the different states handle it.
Well, right, they're saying that it basically it started in nursing homes, and the elderly were the most vulnerable,
Right.
but it had to come in from somewhere. So somebody had to bring it in a nursing home because people
Correct.
don't leave nursing homes, basically. So that's the great mystery: who brought it in, and then how did it take over so quickly? And another thing, how does it kill people so fast? I
Right.
mean, my aunt went in the hospital Friday. By Monday, she was gone. And I know personally a couple of other people who have passed away who are not necessarily older either. They're, in our age group. So it's something that I still don't believe that the medical industry fully understands, because
I
it's
think they're
now it's
still
people.
learning.
Yeah, yeah,
Yes, I think they're still learning about the virus. And as we learn about the virus, all over the world, officials, health officials are encouraging persons to stay home and stay
right.
safe. But recently, especially in the month of March, where you see in Florida, persons were
Hmm.
still going to the beach.
Yeah,
Talk to
yeah.
me about just in New York, were persons adhering to the restrictions or they were just doing their own thing?
Well, I heard over the weekend that the parks were full.
Wow.
So, once again, my first point, common sense. If I would never flock to a beach, I would never go to a park, because I still believe that the disease is still on an upswing. So
Right.
why would you put yourself in danger? And yeah, I heard that in Florida the beaches are open, and they're looking to try to open up Las Vegas, the
Right.
casinos, all throughout Texas, Atlanta, they're open. But once again, use your common sense. And I
Right.
think that's what people really aren't doing. I
Right.
mean, I guess they say, okay, well, it can't happen to me, or I'm young, and but then you have to think about your family members, your
Your
mother,
family,
your father, your
exactly.
grandmother, right? If they get it, they might not be so lucky. So I think people
Exactly.
are really being selfish, and then I see a lot of
Exactly.
people without masks on too. So I think you're being
Wow.
selfish.
Let's talk about the new normal because after this COVID 19 passes, which
Mhm.
all of us are hoping that it will pass
Right.
soon, what's the new normal for New York, for Brooklyn, for Queens, for the minority groups? Because currently, our government is having a restricted re-entry of Jamaicans who need to
Mm.
come back home.
Okay.
For New Yorkers, what you presume would be or will be the new normal?
That's a good question. I really don't know, Rose. I mean, the new normal will have to be, wearing masks, social distancing, and now they're saying that a cough can travel 9 feet, so it's not necessarily the 6 feet. You know,
Wow.
gathering in large groups, you'll have to tone that down. It's just going to be different because it's kind of weird going into a supermarket and see everybody with a mask on.
Right.
And you have people that get violent too. I mean, like, there's been physical fist fights on the train because somebody coughed and didn't cover their mouth.
Wow. Wow.
So I think it's going to get worse before it actually gets better. And the fact that New York lost so many people, I mean, we have like 20%, we have a third of the death. It's
Exactly.
like 60 something
Exactly.
thousand, and New York has upwards of 19,000. And if people don't take it seriously and do the things that they're supposed to do, we're going to see more people dying. So I don't think we're going to even have a new normal. It's just going to
Right.
be different.
And that begs for the question: do you think that we can coexist? Is there a possibility that we can coexist with COVID-19?
Can we coexist with the virus? I don't know. I mean, if they do come out with a vaccine, which to me is like, you know, I'm skeptical because how could they have a vaccine so quickly? But if they don't have a vaccine for it, then I don't think, how could we coexist? Because,
Right,
if you think back to 1920, when they had 1918, when they had the Spanish flu,
right,
it killed over upwards of 10 million people until people just start becoming immune. And
right.
people still don't understand this virus. So I don't think it's going to go away as quickly as people would like.
And the talk of getting rid of the task force
Hmm.
as it relates to handling diseases such as the COVID-19 in the US. Because there are so many different countries that depend on the US for their economy. For example, Jamaica, as it relates to tourism, export,
Hmm.
import. Do you think that the president is making the right choice?
uh, as far as how he's
As far
handling the
as
situation.
as far as the decisions that he already have made, and then
Hmm.
making decision to get rid of the task force.
Well, I think that's a bad decision. I think maybe if we had a better preparation, because I mean, they saw Wuhan, they saw Spain, Italy, the UK, and everyone said that the US is going to follow behind what's happening in the rest of the country. And I think if we were better prepared in the beginning, we
Right,
probably would have been in a better state. And like I said, there's too many narratives going on. So,
right,
at one minute people are saying, "Oh, we're safe. We can go back to work, open up the economy," but still, you have upwards of a million people who have the coronavirus. So how
right,
could both can't be right? And I still don't think there's enough information to make people feel safe. But like I said, I go back to my first point of use your common sense.
right,
And I'm not sure how the economy is going to be affected, but it's pretty bad. It's about what if like 33 million people have lost their jobs in America,
exactly,
and
exactly.
33 million people are not going to get their jobs back. That's just not
Wow.
going to happen. So I think it's a trickle down effect that we haven't seen, and this is only like the tip of the iceberg. It's only May, so by September it probably will be really really bad here.
Right. As it relates to persons surviving, minority groups surviving, because a lot of them are talking about losing their homes, not
Hmm.
able to pay their mortgages, not able to take care of their families. They have
Right.
put in place a stimulus package for persons in the US,
Hmm.
which is similar to here where they have the care package. So, talk to us about how persons are surviving financially.
Well, I mean, if you know that $1,200, that's like the stimulus, and then I think if you have children, you get an extra 500, but I think it's caps at two. But that's not a lot of money in New York. I mean,
Right,
people spend $1,000 to live in a studio. So how far is that going to go? Now, are they going to continuously give us money every month to help make ends meet?
right,
I don't know. That's not really talked about. And then we had a small business loan association, I mean, stimulus, where the big corporations took the money first.
right.
So all those small business owners weren't able to get loans. So there's
Wow.
a lot that has to happen in order for people to be secure. And I think New York has also suspended um, evictions for 3 months. But what happens after that? I mean, I don't
Right,
think, how
right,
long will your mortgage company work with you, or your car note,
right,
financiers, or even your building? And if people don't get back to work, I'm not sure what's going to happen. But I mean,
right,
that stimulus that they gave people in this country, it's not going to last, especially if you have a big family. And it's only for 1 month. So, like I said, what happens? What happens in June? What happens in July
Exactly.
or in August? What happens by December if you're still not working and, say your employer just decided to let you go? And that,
Exactly.
is, if employers start having problems with their liquidity, it's just a matter of time before, even the office workers are going to be let go.
Right. And finally, before we go, mass migration is happening currently. For persons in Brooklyn and persons in Queens, in your region, are you seeing that happening where persons are requesting to go back home to, say, for instance, Africa, Jamaica, different countries, go back home to where they originally came from?
No, I haven't seen that or really talked to anybody who was talking about leaving the US. And I mean, at some point, who knows, other countries may cut off their borders to us because right now we have the leading amount of cases in the world. So would you really want somebody coming from the US to your country who may be infected, who could actually infect people in your country? Um, so I don't see that happening. And then you
Right.
have to have the test. So even if you were going to go back to your country, you should be, make sure that you're
Right.
negative before you go.
Right. Wow. Thank you so much, Chante, for talking with us on the
Oh,
program
you're
on this
welcome.
special broadcast, updating persons living abroad, especially in the New York area, of what they can do and what's happening basically to their family members living in New York. Thank you so much for joining us. And as we always say, from the Mello family, stay home, stay well.
Thank you.
Jamaica Weekly, the voice of Jamaica, is Jamaica's newest and most exciting full-color tabloid newspaper, packed with news, sports, entertainment, and a whole lot more. Jamaica Weekly is free and is distributed every Thursday to businesses and consumers island-wide. Pick up your free copy of Jamaica Weekly today at major retail outlets near you, supermarkets, pharmacies, and service stations. For more information, call 876-616-3031. Jamaica Weekly. Pick up your free copy today.
Need cash? WhatsApp Rapid Loans at 876-403-8048. That's 876-403-8048. Quick loans until payday. All you need is your ID, proof of address, 2 payslips, and a job letter. No security required. Loans for rent, utility bills, medical expenses, and